Hymenoplasty is the commonest surgery in gynecological practice. My duty as a cosmetic gynecologist is to provide the right information so that the patient can make an informed decision. Because ultimately it is a personal choice. Hi, I'm Dr. Chaitali Mahajan Trivedi, a laparoscopic and cosmetic gynecologist practicing in Mumbai. Now, before talking about hymenoplasty, let's first understand what is a hymen. Now, the hymen is a thin, fleshy skin tissue which covers the vaginal opening partially or completely. Just like other body parts, the hymen is also different for everyone. It can be thick or thin, it can be flexible or rigid. Now, what is hymenoplasty and why is it performed? Hymenoplasty involves either the repair of the existing hymen or the creation of an artificial one. Although it is also known as virginity restoration surgery, I would like to clarify that there can be several reasons for a torn hymen besides sexual intercourse, like maybe a tampon insertion, certain exercises like gymnastics, and activities like horse riding and so on. So what are the reasons to restore a hymen? Well, the topmost reason why women opt for hymenoplasty, not just in India but the world over, is cultural belief. In many religions and cultures, it is essential to have an intact hymen before a girl gets married. And in conservative and patriarchal societies, women do not feel gutsy enough to talk to their husband-to-be about their previous sexual encounters. They rather secretly opt for hymenoplasty surgery. This is a sad reality even today. The second reason why one needs a hymenoplasty surgery is because of an accidental injury caused to the hymen. Often the use of tampons causes the hymen to tear or stretch along with other factors like sports activities. Now, in such a case, a woman may feel the need to undergo hymenoplasty surgery. The third reason can be psychological needs. Rape victims or women who have been abused can opt for hymenoplasty to restore the hymen to its prior state. The surgery helps them to cope with their traumatic experiences and gives them psychological comfort. Now, many women after childbirth also opt for hymenoplasty to enhance their sexual pleasure. In such cases, hymenoplasty can be combined with vaginoplasty to tighten the weak pelvic muscles, which is a common problem in women after childbirth. This procedure is called as virgination. Now, coming back to hymenoplasty, a lot of people ask, how exactly is this procedure carried out? Here's how. Now, the procedure of hymenoplasty varies from one person to another depending on the presence or absence of hymenal tags. It is an outpatient procedure that is performed under local anesthesia. Different techniques of hymenoplasty include suturing of the torn ends of the hymen or completely creating a new hymen in case if the hymen is congenitally absent. Now, this procedure involves the use of vaginal lining or synthetic tissue to create a new hymen. As a cosmetic gynecologist, there are certain pre-procedure tips that I would recommend my patients follow to mark the success of hymenoplasty and reduce the complications, such as avoiding alcohol as it can interfere with the medicines and the healing, avoiding smoking, very important, 1 week before and after the procedure, having a proper and detailed conversation with the surgeon to set the right expectations and know what exactly to expect after the surgery. Avoiding blood thinning medicines like aspirin as they can increase the risk of bleeding during the surgery. Now, the second most common question I am asked about hymenoplasty is the recovery period. Well, hymenoplasty is a daycare procedure and the patient gets discharged after a couple of hours. As the techniques of hymenoplasty differ from one person to another, recovery can take a few days to as much as 6 weeks. Although one can return to work within a few days, it is recommended to wait at least a couple of months before getting ready for a sexual intercourse. Now, many patients also want to know, is there be scarring? The answer is no. The procedure usually does not involve any scarring. Hymenoplasty surgery is completely safe, but one should ensure choosing the right surgeon. The right surgeon will be the one who is qualified and experienced in performing cosmetic surgeries. Now, whether it is right or wrong, it is debatable. But various studies show that hymenoplasty surgery has helped restore the confidence of many women. I would again like to emphasize that the most important thing is to be informed and not rush into the surgery. Do your research, consult a cosmetic gynecologist and think it through. If you have any questions for me about hymenoplasty or any other cosmetic gynecology treatments, please feel free to contact me on the contact details given below. Also, if you have found this information useful, please like this video, share it with your friends and subscribe to my YouTube channel for more such videos. Thank you.